Today is International Day to End Obstetric Fistula, which raises awareness about one of the most serious and tragic childbirth injuries, obstetric fistula, a condition that leaves women incontinent and often socially isolated. Experts say it's preventable and treatable, yet thousands of women, especially in low-income and rural communities, continue to suffer in silence due to lack of access to timely medical care. The United Nations and global health advocates are calling for increased investment in maternal health, expanded access to emergency obstetric services, and more awareness to eliminate this condition. In Nigeria, where cases remain high, stakeholders are urging the government to strengthen health systems, train more skilled birth attendants, and prioritize rural healthcare infrastructure. Ending obstetric fistula is not just a medical issue. It's a matter of restoring dignity and hope to women who've endured years of pain and stigma. For more on this, consultant obstetrician and gynecologist at the Lagos University Teaching Hospital Idiaraba, Dr. Fatima Adeboje Jimo, joins me live on the news this hour. Good to have you join us at this time. The prevalence rate of obstetric fistula is put at 3.22, every 1,000 births. How bad is the situation?
Hello, good afternoon.
Good afternoon. Yes, please, I can hear you. I was asking about how bad the situation is in Nigeria. I mean, our obstetric fistula burden.
Yeah, obstetric fistula is such a devastating condition that it's quite prevalent in Nigeria, though may not be common in this part of the country, especially in the north. So globally, we have about 50,000 to 10,000 cases of obstetric fistula, with Nigeria accounting for about 40% of cases. It's such a devastating condition. So it's a crisis in obstetric practice that needs to be attended to. All hands have to be on deck to solve the problem, starting from individual, the community, the policy makers, in order to abate and solve the problems. So we need more of commitment in order to mitigate against the complications of obstetric fistula in our environment.
Right, but why do cases and figures remain this high despite annual commemorations to sensitize about the condition?
Okay.
I'm asking about why, cases have continued to soar despite annual commemorations to call attention to the condition.
The cases are so high in our home settings for a lot of reasons. Poor access. There's this wide gap between the communities, individual, and adequate healthcare facilities. So people don't access, especially in the rural setting. Then also because of cultural beliefs and religious beliefs, some religion and also some communities, they are averted to. They have aversion for having cesarean section. So, for example, if some women have a risk factor for having some complications that may lead to obstetric fistula, such as obstructed labor, which is the common cause of obstetric fistula in more than 90% of cases. Women at risk factors for obstructed labor, when they are identified and they are counseled on the need for cesarean section, elective cesarean section, quite a lot of them have aversion to have cesarean section. So in the long run, they tend to patronize non-skilled birth attendant. Eventually, they end up with obstructed labor. From obstructed labor, we have the complexes of fistula, which is what happens in more than 90% of them. We have a lot of other complications. They face social stigmatization, depression, they leak urine, they solve themselves. So it's we need more education. Our people need to be more educated on this so that they'll be able to have they'll be able to access quality obstetric care whenever it is needed. And also, there's need to bridge the gap between the community, especially the rural setting, and easy accessibility to quality healthcare facility, especially the obstetric care. Then so also there needs to be linked up to centers where they can easily access. If, for example, if a woman is already having some conditions like prolonged labor, and in prolonged labor there's a thin line between prolonged labor and obstruction. Once the prolonged labor is identified in a pregnant woman in labor, the next thing is to make appropriate referral if the facility to have emergency obstetric service is not available. For example, in some of these PHCs, they don't have facility for cesarean section. There should be urgent link to the next level of care, which is secondary or tertiary level of care, where they can easily have access to emergency obstetric care services. Then it's also important for government to assist in the training of healthcare facilities, the staffs of the healthcare facilities, rendering emergency obstetric care services to our patients. So also for those people that are already developed fistula.
Yes, doctor. We can go on and on really about the solutions. I also just wanted to find out about, what your assessment is of the level of reception being given to the sensitization by the local communities, traditional rulers in supporting this cause to protect the, health of women and prevent this obstetric fistula condition.
Pardon?
Yeah, I was asking about your assessment of the level of reception that this sensitization and advocacy is receiving from the different stakeholders in the chain.
Quite a lot have actually been done. Though some of those the facilities given are not common in this part of the world, in the western part, but quite a lot of them we have them in the northern part of the country. Like we have the fistula centers in the Bauchi that is established by the government. Then also we have the international organization have also played some vital roles in reducing obstetric fistula, and also in those people that have had the condition, in helping them to access surgery. So because it is actually preventive, which is the best. But once women have it, then the next thing is to look for treatment. So if they have adequate treatment, they may not end up with the debilitating complications that such as maternal mortality that may arise from. So government have been doing some, but however, more needs to be done so that there will be more investment in the health facilities so that women can actually have access to this care that are needed.
Consultant obstetrician and gynecologist, Lagos University Teaching Hospital, Idiaraba, Dr. Fatima Adebode Jimo, thank you very much for the insights you've shared with us on TVC News at 1.